Hi, I'm Robert Duff. I'm a clinical psychologist from Southern California, and today I'm going to be reacting to some therapy scenes from movies and television. I asked you for suggestions about what shows or movies to do for this, and I got a ton of different suggestions. So today I'm just going to cover 5, but I have plenty of ideas for future episodes if you guys like this. So I'm just going to be looking at the scenes. A lot of these movies or shows I have not seen before, so I'm going to be reacting as a psychologist to what I see and sort of breaking down some aspects of it. Okay, so first scene we have here is from What About Bob? This is a movie I have not seen, so let's get into it.
Why don't I start? Huh?
So first thing, before they even start talking, that I find interesting about this is, if you notice, they are across a table from one another. So the main character and the therapist is across the table. To me, this screams psychiatrist. So a psychiatrist is a medical doctor, somebody who focuses on prescribing medication, and sometimes they also do therapy. This is more of the old school model. Psychiatrists used to do a lot more therapy. Now they primarily focus on medication management, but some still do. And so this sort of situation looks very medical to me. When you put a table between you and the client that you're working with, it creates this inherent power dynamic, right? We know just looking at this scene, who's the patient, who's the therapist. And that can be used sometimes as a tool. I don't prefer that, especially if we're actually doing therapy work. If this is like a clinical interview, trying to get to the bottom of somebody's diagnosis and being very focused like that, okay, you might be able to use this situation, but when you're trying to get somebody to open up and trying to help them with their emotional problems, having this set power dynamic is something that at the very least you should be quite aware of.
Simplest way to put it, I have problems. I worry about diseases, so I have trouble touching things. In public places, it's almost impossible.
His posture is fine. So you see he kind of has like a laid back posture like this. Some people will really put a lot into the posture that a therapist has. They'll say, you know, you're not supposed to have closed arms or like crossed legs or anything that closes you off, which is true to an extent. I don't think it's as big of a deal as a lot of people make it sound. If you're comfortable, if this is who you are and how you tend to sit, I think that's more important. So this looks like the person is really listening and is very interested. So I think that's more important than being sort of wide open and leaned in and engaged. And also, like I said, there's this sort of power dynamic that the therapist is playing with where, you know, he's kind of sitting back, letting the person talk, taking in this information. So I think he's intentionally using that in this scene.
I have a real big problem moving.
Talk about moving.
Talk about moving. So that's a good example of what I would call like an open-ended prompt. In therapy, you have a lot of questions that happen. You can have closed-ended questions, so yes or no questions. Does that make you sad? Would be a closed question. Or an open-ended question like, how does that make you feel? That would be an open-ended question where there's no specific answer for that. This would be more of an open-ended prompt, so talk about that. That's something that I really like doing a lot in therapy. I'll say, tell me more about that, or talk about that, or speak to this. Something that's kind of a prompt. I'm not just asking a question, but I'm opening it up for them to just talk about it how they will, instead of putting ideas into their head about, does this make you feel this way, or this way, or this way? So I do like those kind of prompts.
As long as I'm in my apartment, I'm okay. But when I want to go out, I get weird.
Talk about weird.
Talk about weird. Well, I get dizzy spells, nausea, cold sweats, hot sweats, fever blisters, difficulty breathing, difficulty swallowing, blurred vision, involuntary trembling, dead hands.
So again, I haven't seen this movie, so I don't know what his issue is. It sounds to me like he's describing agoraphobia, which is a fear of being in public spaces, or at least being in spaces where there's no escape if you feel like you're having a sort of freak out or a panic attack or something like that. One thing that I would notice if I was a therapist is that this person has a lot of clinical vocabulary. They're saying, I have this symptom, this symptom, this symptom, this symptom, this symptom, which always makes me wonder how much of this they've already sort of looked into. That can be a sign that they're just proactive, but it can also be a sign that they're kind of self-diagnosing and they're maybe doing this for a purpose. So without making any assumptions, that's something that I just want to pay attention to.
Numb lips, fingernail sensitivity, pelvic discomfort.
So the real question is, what is the crisis, Bob? What is it that you are truly afraid of?
What if my heart stops beating? What if I'm looking for a bathroom, I can't find it, and...
So that, again, you know, the crux of like agoraphobia is not literally being afraid of being outside. It's being afraid of being exposed, having something bad happen and having no way to compensate for that, feeling like you're going to need to take a dump because your anxiety is making you flush your system out and not being able to find one, being afraid of having a panic attack and looking crazy and then people calling like the police on you or something like that. It's sort of a sense of, it can almost be like a claustrophobic sense when even though you're in a crowd of people, you feel like there's no escape and everything's kind of closed in on you. So that's a good example of that. I would say his therapist is being pretty forward there, saying, so the real question is, what are you afraid of? It's a movie, it's a little typical, you know, but that was a pretty forward question. In this case, it seems to pan out.
My bladder explodes. Have you ever heard of Tourette's syndrome?
Mm-hmm.
Involuntarily shouting profanity.
It's exceptionally rare.
So it looks like they muted out a scene where he's swearing. I haven't seen this, so I'm assuming he's just swearing top of his lungs, doing this kind of what he would see as the Tourette's type reaction. So he's just trying to get a rise out of the therapist. Unfortunately, in this scene that I picked up on YouTube, they muted that out.
If I fake it, then I don't have it. You know, it's the same with the cardiac arrest. Oh!
So that was a fun scene. He is putting on a show for the therapist, and what I liked about the therapist's reaction was he gave him very little reaction. You often want to be thinking about sort of what is the point of this behavior? What is this person trying to elicit from me? Do they want to be saved? Do they want to be, you know, cared for? Are they just looking for understanding? You know, what is the intention behind what they're saying in their behavior? And so in this case, he's kind of putting on a show. Again, I don't know the whole context there, but there were some aspects of it that were pretty cool. Some aspects of it that were, you know, obviously silly. In terms of the therapist's approach, he was basically playing that expert role, trying to be very wise, trying to be very unimpressed. That's important sometimes. A lot of times in therapy, you are tested as the therapist, especially people who might be, you know, have sort of like an antisocial streak, or people who have a degree of like psychopathy. They'll test you to want to see, you know, are you competent? And it's not just those people, but many people in therapy will do that. And so you have to decide how you're going to deal with that, whether you're going to react, whether you're going to stay neutral, whether you're going to shrink back in some way. These are all valid approaches. It just depends on what your intention is as a therapist going into this. So that was What About Bob? Let's check out the next one here. Okay, next scene is from Freaky Friday, which I have seen, but it's been a very, very, very long time. So I remember the basic premise, which is the mom and the daughter switch bodies. That's about it.
So I started reading your new book, and it just makes me feel really depressed. And how do you feel about that?
Okay, so, and how do you feel about that? Obviously, that's like the stereotypical question, right? And I've been in therapy so many times where I have the urge to ask that, like, so how does that make you feel? Or how do you feel about that? And like, I catch myself because I want to like laugh/vomit when I'm going to do that. It's a great question because it's important. You know, what you want to get at is the affect behind what they're talking about, meaning the feeling behind what they're talking about, because they may not be aware of that, at least in their, you know, front of the mind awareness. But that's kind of silly.
Depressed.
So obviously this is a silly scene, but I'm going to react to the aspects of it that I can. So the setting here is a lot more like a real therapist's office, not like a psychiatrist in that sort of setting. And many psychiatrists don't have that setting, to be clear, but this is much more of a comfortable setting where it's kind of a home environment. There's comfortable chairs and couches, and it facilitates, open conversation, and it's comfortable. You notice she's hiding behind her clipboard, which is something that you want to try not to do. The last thing you want to do is make somebody really, really paranoid about what you're writing down, and you don't want to make them feel like you're not listening to them. So having a clipboard, writing down notes, or in some cases now actually typing on a computer is common, especially in like medical settings. If you have like a medical, your insurance is like kind of a big medical network, you might be going to see a therapist in the same place that you have other specialists, not like a private practice, and they might be typing on the computer, which I have mixed feelings about. But either way, you don't want the notes that you're writing to be intrusive. And doing this is going to make the person wonder, okay, what are you writing? So in this case, obviously she's actually hiding behind it because she's weirded out by the situation and doesn't know how to do this job because she's I don't know how old the teenager is, but she's a teenager in this woman's body. So that's funny.
And how do you feel about that?
She and her best friend aren't speaking, Doctor. And in her diary, she keeps mentioning this boy.
And how do you feel about that?
Well, I'm worried.
You read it?
Okay, before I get into the next part, this is actually kind of a therapeutic technique. There's a technique called the downward arrow exercise where you ask the same question over and over to try to get down to what the real fear is, what the real concern is, what the real worry is. A lot of times I might ask, what would be so bad about that? They say, okay, well, I'm worried about giving a speech because I might stutter. Okay, well, what would be so bad about that? Well, if I stutter, then people are going to know that I'm not confident. Okay, well, what would be so bad about that? And you keep going and keep going and keep going, and then eventually you get down to sort of a nice little nugget of real information. Like, what would be so bad about that? Well, they would know that I'm vulnerable and they could hurt me. What would be so bad about that? Well, I've been hurt before and I don't think I could take it again. Something like that. And you get deeper and deeper and deeper by asking the same question, repetitively. This is not her intention here, but it is actually kind of an example of that.
Her diaries? Oh, that's gross. That's bad Mama Ward.
But I'm concerned, Doctor, that she and this boy might be...
Stop. Nothing is going on between her and this guy. Because if there was, she wouldn't be writing about it in her diary. She'd be out there doing it. And her best friend probably isn't talking to her because she probably likes this guy too. And he probably even flirted with her a little bit. But he secretly likes your daughter. He just hasn't made his move yet because that wouldn't be cool. So now her best friend is acting like some psycho freak. Okay?
So that's obviously like funny, but this just goes to show, like, as a therapist, when you're approaching a situation, you're not the expert, right? You're being sought out as an expert in psychology and all of that, but like to the mind of the person that you're working with, you are not the expert, they are the expert. So in this case, they're talking about this person's child, and this is a peer that's trapped in this woman's body. And so she's going to actually be able to relate a whole lot more and understand the intricacies of it a whole lot more than this, expert person who they're coming to. So that's a good example of why you shouldn't assume that you know everything about a person's situation, because, you don't.
That's very interesting. I never would have thought about it that way.
Cool. Guess we're done.
I will confess to having doodled before on notes, that like therapy notes. Typically it happens a lot more when I'm doing testing. I do a type of testing where I test people's memories and things like that, and I have it down to autopilot. So sometimes, when I'm waiting for them to respond, I might doodle in the margins or something like that, which I hope never comes up for a court case where they have to look at my files, but I will confess to having done that before. All right, so next one we're going to react to is from To the Bone. This is a scene from To the Bone, which I have not seen. I understand it's about eating disorders. And Lily Collins definitely played the part quite well from what I've seen. And Keanu Reeves is the therapist, so this should be interesting. before I get into that, the scene looks realistic. It looks like a real therapy scene, especially in sort of treatment setting. I like that it starts with silence here because that is a big part of therapy. A lot of new therapists will feel really, really, really uncomfortable with silence and try to fill that with suggestions and things and stuff. And sometimes that actually clouds the person's ability to come up with what they're actually trying to say. You know, if you jump in with ideas and thoughts and help them fill that silence, it doesn't give enough emotional room to really feel it out. So in some cases, people, you know, certain therapists, certain types of therapists, especially if they lean more heavily toward like psychoanalysis, psychodynamic, the kind of therapies that stem from Freud, they might be silent for quite a long time and just let this person freely associate. And so they're kind of starting with a little bit of that silence, which I like.
I just don't see the point.
In what? There is no point. Or at least big picture, we don't get to know what it is. Why we live, why Megan lost the baby, why that girl killed herself.
You're not reassuring me, Doctor.
I can't reassure you. This idea you have that there's a way to be safe.
Okay, so he's taking obviously a big risk here, kind of being very forward with her. There are times where this is appropriate in therapy. This would not be like a first session with this person. I assume that at this point they've had kind of an established therapy relationship. And I think that there might be sort of a transference, counter-transference thing happening here, which means the feelings that the client elicits in the therapist and vice versa. The client will inevitably kind of put the therapist into a category with other people in their lives. So they might see them as like this type of figure or that type of figure. And I think in this scene, the therapist Keanu Reeves has sort of adopted like a mentor, caring parent or family member type of role. So that's something that can be worked with, but it's something that you should be aware of what's being pulled out of you as a therapist. And so he's kind of just calling her bullshit here, which is appropriate sometimes. If you need to break through something that just hasn't been broken through yet, especially if there have been failed attempts at therapy over and over. Sometimes you just need to say something and get it out there. This is pretty forward though.
It's childish and cowardly. It stops you from experiencing anything, including anything good.
You don't think I feel bad enough already? I know I'm messed up. But you're supposed to teach me how not to be.
You know how. Stop waiting for life to be easy. Stop hoping for somebody to save you.
This is a bit much, I think. He's obviously coming from a place of care, but the words he's using, they sound insulting. Perhaps that's what he wants. That's what he's trying to do. You would have a hard time passing that by a review by another psychologist or something like that, though. You know, a supervisor, etc. He's being pretty hard on her, which, you know, I don't know if he's a licensed psychotherapist in this movie or if he's just like an addiction counselor that has a different type of certification. As a psychologist, I would be careful with this type of language and going this hard on it. Maybe little bits of that, but just drilling into her in this way might be a little bit much.
You don't need another person lying to you. Things don't all add up. But you're resilient. Face some hard facts and you could have an incredible life.
That's your pearl of wisdom?
That's what I was thinking.
Grow a pair?
That's a more concise way of putting it. Yeah.
Okay. So I already gave my reactions to that. I think he's being pretty forward. This is probably the scene I'm imagining where he kind of shifts from being, okay, I'm just like every other therapist, to I'm somebody who's going to call you on your BS and I'm not going to settle for this pattern that you've fallen into with everybody else, which again, I think could be a good thing. I think he went a bit far with it in this scene though, and I would probably do the same thing in a different way if it were me. Okay, so now we're going to get into a scene from House. I did watch House, great show. It's been a very long time since I've seen it, but really, really well-written show. Lots of medical things that are just off the wall and totally inaccurate. So I don't remember a therapist scene in this, so we'll see how this looks. So we see on the door, this is a psychiatrist. So sort of meeting him as a medical doctor in this sort of setting. In my experience, a lot of doctors are more comfortable working with other medical doctors, like psychiatrists. That's not necessarily always the case, but I can see why that would be the case here. Old school fainting couch. So this person has sort of the old school vibe that's like modernized. They have a lot of these little motifs in the office that indicate, you know, that they are a psychiatrist, that this is the tradition that they come from. The old school fainting couch comes from that old psychoanalytic tradition where you might lay on the couch and free associate, things like that. That's obviously not what they're doing here, since this is a different setting. He's sitting up in a chair, they're going to be facing each other, all of that. But those are little hints as to maybe this person's approach.
So how's this supposed to work?
You sit, I sit, we talk.
About what?
About whatever you want.
Want me to whine?
Notice the open posture, right? He's kind of matching. That's one thing that you might do in therapy is actually match the client's posture if they're very closed or if they're open. You don't have to like mimic them, but there is some validity to kind of matching where they're at as a means to get on the same page so that you can move forward. Definitely doing that here, very open, very comfortable, even though the actual tension is there with House not knowing what to do here.
And about my mother?
Do you want to whine about your mother?
I tell you, by the time I was 5, my goldfish died.
If that's where you'd like to start.
I've had a billion things happen to me in my life. How am I supposed to know which ones are relevant?
As far as I'm concerned, they're all relevant.
Well, we better get moving, because this session could take 50 years.
Yes, you are the sum of everything that's happened to you, and yes, some events are more relevant than others. But the only way we can figure out which ones are is to talk. So tell me, what's on your mind?
I like that the therapist here is not doing the work for him. House probably trying to get him to do that, right? Fill in the space like I was talking about, and he's saying, no, yes, you're right. Some things are overwhelming. Some things are, too broad to pull everything together, but we got to start somewhere. So you start us off. So he's really making House do the work here, which is good.
What do you want?
I want to get better. Whatever the hell that means.
It's a good place to start. There are these things called stages of willingness to change, or stages of change. There's different terms for it, but people can be way on one end of the spectrum where they don't even recognize they have a problem. They could be in the place where they recognize a problem, but they don't know what to do with it. They're not sure if they want to change yet. Or they could be in the stage where they recognize a problem, they want to change, but they don't know how. That's a good place to start treatment, if that's actually how he does feel.
I'm sick of being miserable.
So you like to be happy?
Again, with the reflecting, yes, I'd like to be happy.
Being happy is an excellent goal. Not many patients can crystallize exactly what they're hoping to get out of this.
Well, bully for me.
So now, all we have to do is figure out how to get you from here to happy.
SSRIs? That's your genius technique?
I don't think we should ignore any tools that can help. I know you don't have a problem taking drugs.
For my leg. For pain.
Well, think of this as being for psychic pain.
I don't want to change who I am.
Miserable?
I'm not sure what the sort of punchline of the scene is. I'm wondering if he's giving him a placebo, because you can't just give someone medication like that. Just like first meeting and all of this. Though we know House doesn't play within the rules, so maybe this guy doesn't either. I will say that to House's fear, a lot of people do fear that taking a selective serotonin reuptake inhibitor, an SSRI, or other types of psychiatric medication will change who they are at a fundamental level. There are some medications that are much more heavy hitting. SSRIs typically are not one of them. They just sort of change your baseline level of reactivity. Of course, you could have some side effects and things like that, but you're not going to completely change as a person. And they're not the type of thing where you're going to be ruined forever, even if you do have some changes. You could go off that medication and bounce back to whatever it is that you wanted. So that fear is not necessarily realistic in many, many cases.
You think that by taking meds, you'll lose your edge? Stop making the unique connections that make you a successful doctor?
If Van Gogh was your patient, you'd be satisfied painting houses instead of the Starry Night.
Van Gogh would still be making inspired paintings of the night sky. Just maybe not from the room of his asylum.
You don't know that.
I know both his ears would be intact. And I know his life would be better.
So he's kind of doing a pros and cons type thing with him. He's saying, like, you need to recognize the weight of the opposite side. Like, could you potentially lose some of your edge? Sure. Could you also wind up dead and have no patients to care for at all? Definitely. So you need to weigh those appropriately.
I know this doesn't come naturally to you. But you want my help. Which means you need to trust me.
Delicious.
So again, my guess is that was just a placebo, and that was his way of kind of crossing the line to, okay, I need you to buy into this. Especially in this case, the house probably isn't even paying money for it. It's probably set up by the hospital. But that would be a totally inappropriate, unethical way to do that. Sometimes you do, though, need to get somebody's buy-in before you can start actually working on stuff. So it is what it is. Let's do one more. This one's going to be a scene from The Sopranos, which I've never actually seen. I know it's a great piece of television. Never had the chance to see it. Right off the bat, dude is anxious, totally normal, especially when you're in the situation where you're waiting and you have to wait for the therapist to be ready for you, something like that. Absolutely normal to have some anxiety about that, especially if this is something that you're not used to. Again, pretty typical therapy setup, just 2 comfortable chairs, books in the background, things like that. Nothing weird about the setup here.
I came here today to tell you, in all seriousness, that I'm done. I did what you said. I gave it a lot of thought, and I decided that once and for all, it's over. The truth is, this therapy...
Notice no reaction from the therapist.
You know it, and I know it.
I actually don't know it, but please continue.
It's a jerk-off.
Yes, you've said that.
Anyway, I was coming here to quit. Had it all planned out. But guess what? My son is talking suicide. So now I'm trapped here forever.
My God, what did he say?
His girlfriend, fiancée, whatever. She broke up with him.
She's got a weird vibe, the therapist. Her tone and what she said didn't match her facial expression, which is interesting. It sounded like disingenuous to me. I don't know, that's just the way it hit me. In therapy, a lot of it happens in your face, you know, like you can do something called I call it like a face hug, you know, right? Where you're not actually gonna get up and hug the person, but like you wanna demonstrate compassion and like, if you could, you would hug them. Like that sucks, right? In this case, she's like, oh my God, what happened? And that's just a little funny. Clearly she's not afraid to kind of challenge him a little bit, say, no, by all means, keep going. You know, if you want to play this out, play it out, which is cool. But that's interesting the way that she said that.
He's beyond devastated.
Would you like me to recommend someone for him to talk to?
Carmelo's getting a referral from his own pediatrician.
Oh.
After that incompetent you said Meadow to? So I suppose now comes the inherent fucking grilling about how I feel about all this.
Isn't that why you're here?
You know, friends of mine, they got sons his age, and they're happy, ambitious. They fucking take life as it comes.
I know it seems that way, but do you really know these other boys?
I know what I see. My son curled up on a couch in a fetus position when he should be out banging co-eds.
Have you talked to him?
Till I'm blue in the face. We both...
There are some shows where they consult with psychologists, with therapists, things like that. I don't know that they did here, this person seems to be doing their best caricature of what they think a psychologist would be doing, what a therapist would be doing. She's just kind of asking these closed-ended questions, reacting directly to what he's saying. Not, I don't know, the vibe is just off here to me.
Both have. And now we're afraid to talk to him because of what he might do. Obviously, I'm prone to depression. A certain bleak attitude about the world. But I know I can handle it. Your kids, though.
She's at least giving him space to explore, which I really like. You know, he needs to explore this. She can't jump in and save him.
It's like when they're little and they get sick. You'd give anything in the world to trade places with them so they don't have to suffer. And then to think you're the cause of it.
How are you the cause of it?
It's in his blood, this
It's an open-ended question.
miserable fucking existence. My rotten fucking putrid genes have infected my kid's soul. That's my gift to my son.
Again, allowing that space, totally appropriate.
I know this is difficult,
but
I'm very glad we're having this discussion.
Really? Really? Because I gotta be honest, I think it fucking sucks.
What does?
Therapy. This. I hate this fucking shit. Seriously, we're both adults here, right? So, after all is said and done, after all the complaining and the crying and all the fucking bullshit, is this all there is?
that's a good saying. He's very, very resistant client, you know, questioning what is the point of all of this. And there are different approaches to take. You know, you could explain, okay, these are the benefits, you know, research says it works, things of that sort. That might work for a certain type of person. Another type of person, you might just need to say, well, you're here, right? Let's make the most of it. You came back. Seems to me that there are some things that are subtly shifting here. Let's work on those. But overall, like I said, I don't think this person that's playing the therapist had much feedback from an actual therapist because it just seemed a little rudimentary. However, in a lot of cases, you know, you giving the person space, they're going to work it out on their own. Somebody making the attempt to come into therapy, crossing that threshold, a lot of the work is going to happen automatically, especially if they have some trust in you to be able to hold their problems and listen in that way. So a lot of it can happen just sort of on their own because they're doing it. But you know, there are some techniques, there are some things that can be done to help facilitate that as well. And not just asking closed-ended questions and having kind of uncomfortable reactions to things they're saying. So those are the 5 scenes I wanted to react to today. Hopefully you guys enjoyed it. If you have suggestions of therapy scenes or any sort of mental health related content that you'd like me to react to in this way, let me know. Put it in the comments or send me an email to duffthepsych@gmail.com. And I'll see you for the next one. Bye.